En 1996, le Dr Calvin Gutkin est devenu directeur général et chef de direction au Collège des médecins de famille du Canada. Depuis, Cal a mis toutes ses connaissances, son expérience, sa passion au service du Collège afin de mieux répondre aux besoins changeants des médecins de famille et de leurs patients, et ce, partout au Canada. À la fin de l'année, nous allons saluer Cal au moment de sa retraite. J'ai eu le privilège de travailler avec Cal pendant plusieurs années. Je suis certaine que son leadership, sa passion, son amitié et oui, même ses talents de chanteur nous manqueront. During his time with the CFPC, Cal oversaw the evolution and elevation of both the college itself and the discipline of family medicine. It was under his guidance that family medicine came to be recognized as a specialty in Canada. During his tenure, the number of college members as well as the number of staff more than doubled. Cal established Family Medicine Forum, which quickly became Canada's premier family medicine conference. Cal enhanced advocacy activities in the college and strengthened the value of family physicians across the country. Avant son départ, nous avons discuté avec Cal des années qu'il a passées comme chef à la direction du collège. Nous vous proposons une série en 4 épisodes qui relate les défis qu'il a affrontés, ses réalisations et quelques détails sur ses projets d'avenir. Please stay tuned for part 1 of Conversations with Cal, In the Beginning, part 2 of Conversations with Cal, Reaching the Milestones, part 3 of Conversations with Cal, The Challenges We Face, and part 4 of Conversations with Cal, The Next Chapter. Enjoy!
Let's talk about the future. What do you see as challenges in the future for family medicine?
So I think there's lots of challenges. I think amongst the main ones are the fact that the role of all healthcare professionals is changing, and it's changing in the context of team-based care. And we have to recognize how that's changing and be able to adapt to what is happening in the world around us and the world that we are part of. And it does not mean that the family physician is not going to continue to play a central role. It does not mean family physicians should not be providing comprehensive continuing care, but I think they should be doing it as part of teams and sharing some of that environment with others whose scopes of practice have now advanced beyond what they were 10 or 20 or 30 years ago. So when we see that nurses who have additional training are able to do more than they used to be able to do, pharmacists can do more than they used to be able to do, and that may apply to many other professions that I can name, and I can't possibly name all of them. They all belong to this team. It's part of the patient's medical home concept, is that you work together. And in terms of access to care for patients, I do believe that every person should have a personal family physician who's going to be central to their delivery and coordination of their medical care. They should identify with that family physician. But they should also be able to identify with nurses or nurse practitioners, with clinical pharmacists, with others who are needed by that individual. I think the establishment of the section for family physicians with special interests or focused practices is important. Not to create a plethora of mini specialties. That is not our goal. But we have seen that family doctors are making these choices out there in their practice environments. This is what they're doing. They're learning, picking up skills in additional areas, and either focusing their entire practice, which is not really our ultimate goal, or a portion of their practice on special interest areas. We think that this is needed, and that these family physicians who've turned to us and said, we want our college to be the professional home for us as well, not just for family physicians who have the traditional kind of practice. Well, we want and believe that we should be the home for all of those in family medicine who are contributing to the comprehensive continuing care that should be delivered not just by individual physicians, but by teams of family physicians working together so the patient gets comprehensive continuing care. So focusing on special interests and trying to make sure that most people who have special skills and special interests will have the training they need, will have the continuing education they need, but very importantly will actually choose and be supported to do it as part of a broader scope practice. So that whole spectrum of the changes in other health professions, changes that family physicians have to embrace, and changes that other specialists have to embrace is, to my mind, the challenge, a major challenge for the next 5 to 10 years in healthcare in Canada.
So physicians will need to change and adapt, but how will the college need to change to be effective in meeting these challenges?
So I think some of that change has started, and it's just the tip of the iceberg in terms of what has to be done. I think the college has to look at welcoming in those who are in other health professions to be learning together with us, particularly on the continuing professional development side. So we have opened Family Medicine Forum to those in other professions who work with family physicians. We have looked at our category of associate membership for those who work in both academic environments as well as practice environments with family doctors to join our college in a special category of membership for them. I think that this is vital. If we're talking about teams, we have to walk the talk. And walking the talk means that we don't just talk about it happening out there, we've got to make it happen here. And I think that that's a very important vista that has begun, has opened its doors, but that there's a lot that needs to be done over the next while. Those, I think, are really significant challenges.